Today's webinar is going to be on workplace inspections in hotels, essential tips to ensure compliance. My name is Gareth. I'm the communications manager here at BCHA. We are really fortunate to have Lonnie here from Go2HR, who's going to help us, will help you prepare for workplace inspections administered by WorkSafeBC. Lonnie is an industry health and safety specialist with Go2HR. She works with employers to provide guidance on their workplace health and safety and delivers innovative ideas on protecting workers and reducing costs for employers. This webinar will last the full hour, and there will be a Q&A portion at the end of the session. Feel free to type your questions in the Q&A box throughout the webinar, and we can answer them at the end. Prior to handing things over to Lonnie, I'd like to welcome our host for today, Justin from Advanced Insurance Services. Justin works with the association with the Canadian Hospitality Health Plan. This is an employee benefits program that was created by the BCHA along with our counterparts, Alberta Hotel and Lodging Association. Justin's going to give a short overview on the plan itself and its benefits before we hand things over to Lonnie. So at this time, I'd like to introduce Justin.
Thanks, Gareth, and thanks for inviting me to host this session. Just for any of you who by chance haven't heard from our team, and we're working both for the Alberta Hotel and Lodging Association and the British Columbia Hotel Association, this really exciting and innovative not-for-profit initiative that is actually owned by members by virtue of your membership through the association. This a new corporation that was set up, the Canadian Hospitality Health Plan, as I mentioned, is a not-for-profit. And one thing that it does really is offer a method of ensuring your employee benefits in a similar manner, or if not virtually the same manner that very large corporations are able to do. And that's simply because of their size, scalability, and their ability to take on risk. Standalone hotels just don't have this ability, and as a result, they have to pay an insurance company additional costs to run their program. So this new structure, as large corporations exist with very large spreads of risk, they can run their program through what's known as an ASO, or an administration services only program. And really what that does is it enables them to pare down their costs to only the claims and the administration costs without that insurance company charge. Now, the associations, what they're doing through mimicking this is bringing members together and pooling them as a very large group, like a large corporation. And the structure as a member-owned not-for-profit has annual financial reporting to ensure that everyone's getting a very good value for what they're paying for employee benefits. And it's also by removing that insurance company cost. The only true insurance is on very large and volatile costs like health and dental. So really, just in summary, I don't want to get into anything deep here, but just wanted to introduce this. This new program is very cool in that it is owned. You become an owner of your program, you're cutting out the insurance company and creating a collaborative purchasing model. So there's cost savings to reduce costs. The members collectively own surpluses or funds that are left over at the end of the year, which normally the insurance company keeps. So you're taking that insured profit and putting it into your program to offset future costs. And this is a very unique program that has total flexibility for each hotel to run the program exactly how they need it for their program, for their unique needs. And then I just also would want to introduce Johnson Group. They work as that primary third-party administrator and claims payer. They're great at what they do. They're consistently recognized as one of Canada's best companies. And they actually specialize in running not-for-profit programs like this. And in terms of interest in joining the program, feel free to reach out to the association or directly to us anytime. You can check out the website. It's easy. It's chhp.ca. And we look forward to connecting with you on that program and helping any of you to reduce your costs.
Awesome.
I'll let Lonnie share her slides now.
Okay, great. Thank you so much, Justin, and Gareth, for the great introduction there. Can somebody give me a thumbs up if they can see my screen? It should be popping up in 2 seconds here.
Yeah, be good.
Yeah. Okay.
Perfect.
Awesome. Awesome. Okay, so we're going to talk about inspections today, and there's quite a bit to cover. So I'm going to try and go quite quickly, but at the same time, give enough time for each topic. So yes, welcome. I'd like to acknowledge that I am presenting actually from my home office in Kelowna, which is located on the traditional unceded territories of the Syilx Okanagan peoples. And beyond that, though, I'd like to also make a special mention that GoToHR's Vancouver office is located on the traditional unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. And then additionally, GoToHR's work across the whole province takes place on the traditional unceded territories of 203 distinct nations. So we pay respect to these nations and are grateful to live, work, travel, and play on all these lands and waters of the BC's Indigenous peoples. So thank you for that. Before we get into it, Gareth gave me a little bit of introduction, but I'd like to give a little bit more of information about myself and then about GoToHR as well. So like he said, I'm the health and safety specialist with GoToHR. I've been working in August, it'll be 3 years with them in this position, which is very fun. And previously to that, I've worked in a variety of types of different operations within our industry, including ski resorts, outdoor tourism operations, and restaurants, and a bunch of different other ones. So I'll be asking some questions throughout the presentation. So if you haven't already, please find the chat box to test it out. I'd love for you to tell me what your name is and what hotel you're with. I was looking through the contact or the attendee list as Justin was speaking, and there's definitely some familiar names there. So hello to you, and to the ones that I don't know, hello to you as well. Okay, so GoToHR is a nonprofit organization. We're the health and safety as well as the human resources associations for the BC tourism and hospitality industries. So we work in health and safety, human resources, we have industry training, and then also research and strategy. So really the bottom line, if you're not familiar with GoToHR already, is that GoToHR exists to drive strong workforces and safe workplaces within the hospitality and tourism industry within our province. So if you haven't already, go check out our website, gotohr.ca. You'll find a bunch of information about our industry. We also have an industry-only job board that you can use for free. We have labor market trackers, training programs, a wealth of information and tools and templates. You can sign up for our newsletters as well and get all the updated information as it comes available. Okay, so our journey today is going to hopefully elevate us from the ground floor to the penthouse when it comes to preparing for inspections. So we're going to start with an overview of the topic, and then we'll move up to talking about the different focus areas for hotel inspections specifically, and then how you can prepare for inspections. So you know what to do before, during, and after the inspections. And then I've got some great resources for you that I've curated for you. And then also we'll have some Q&A time at the end of the presentation, hopefully. Okay, so first question. I'd like to start with this question just to gauge where we're at. So you can put your answer in the chat box, please. So on a scale from 1 to 10, what's your confidence level if an inspection was to happen right now? That you could meet all the requirements, that you would not be too anxious about having the inspector on site, all of that kind of stuff. So put your answer in the chat, please. And you also, chat features disabled. Oh, that's too bad. Okay, well, maybe just self-answer it, or maybe Gareth can fix that potentially.
Yeah, I'll work at it.
Okay, thanks. Yeah, so for now, just note your number down on that scale so that we can kind of gauge at the end of the webinar where we're at with being ready. And I'm hoping that you'll feel more prepared and ready to ace the inspection if it does occur after this session. Okay, first we have to talk about the funnest topic ever, which is regulatory compliance. So the Workers' Compensation Act and the OHS regulation are the overarching pieces of legislation that govern all health and safety in British Columbia workplaces. So it tells us what we need to know and where the minimum standards are set. So sometimes there's changes to those regulations that employers need to be aware of. So if they meet the regulation, it's their responsibility to meet the regulation, right? So you need to know if it's changing. Sometimes those changes have song and dance about it. So it's your responsibility as the employer to keep your eyes and ears attuned to that evolving landscape. So British Columbia is unique as a province because it's one of the only provinces that has the regulator and the enforcer in the same government body. So through public consultation and all these different steps, WorkSafe determines the standards or the requirements for the workplace health and safety, and then also they enforce those rules. So one of the ways that they do that, though, is through conducting an inspection, which is what we're going to talk about today. But before we get too deep into inspections, I do want to highlight some of the recent regulatory changes that have happened or are currently happening so that you're aware. So the first thing that we're going to go over is injury management, or Bill 41, that came into implementation in January. And so it was best practice previously to that, some of what's included in the bill to manage those injuries well, but there's now some legal requirements for that, whereas it was just really best practice last time or before that. So for instance, if you have a housekeeper who sustained a back injury, there's a legal duty for that worker as well as for you to cooperate with each other to get the worker back to work as early and as safe as possible. So that's the duty to cooperate, and it applies to all workplaces in BC. Now, the duty to maintain employment differs a little bit. So if you meet certain criteria, then it will apply to you. So maintaining employment of an injured worker includes finding suitable work for the worker and continuing the employer-worker relationship past that closing date of the claim. So it only applies to employers with more than 20 workers, and the workers must be employed for 12 continuous months in order to qualify for it as well. So for example, if you're a smaller operation with less than 20 workers, or even if you're a bigger operation and you staff up during the summer and one of those injured or workers gets injured, then the duty to maintain employment would not qualify for you. So there's a great webinar that we did back in February about this specific topic. And so when you get the slides at the end of this presentation, you'll be able to click on that. But yeah, we hosted it with WorkSafeBC. And so if any of this is confusing, you might want to make some time to watch that recording. I think we got the chat working. Awesome, great. Okay, so that is the first changing regulation that I wanted to mention. And then the second one here is workplace first aid. So it's coming into effect on November 1st of this coming year. And so they have changed a bunch of different things. The classification of workplaces, they're requiring a first aid assessment to be written now, which there wasn't a written requirement before. There's new mandatory requirements for what needs to be included in the procedures. Drills have to take place. The first aid kits and certifications are now going to be aligned with the DSA standards. There's emergency transportation that's called out specifically, and then also there's additional direction for the first aid rooms. So lots is happening in the first aid program area. So we have created a web page where we explain it all, and all the updates will be posted there. So that might be something for you to bookmark for the fall. So I encourage you to continue with your your current programs for the summer, and then in fall, we can tackle the new requirements. A lot of resources are going to be posted by WorkSafe and then also by us. And that's probably later summer into fall. And so you'll want to stay tuned for that. Worker participation is another hot topic for regulatory changes, though there's no announcement of when those changes are going to be implemented yet. So what we do know and what we anticipate is that there will be an increased requirement for worker involvement in all things health and safety. So one of the main ways that we're involved currently is through the joint health and safety committees, and for small employers, their worker health and safety reps. So I encourage you to take a look at how you're involving workers and find ways to strengthen that, because it's only going to increase from here. And if your committee is effective and thriving, then you shouldn't have any trouble meeting the new requirements once they come out. I will also do a shameless plug here for our Joint Health and Safety Committee training. We launched that at the end of last year, and it's an online asynchronous course that sets new committee members up for success in their roles on the committee. So it meets the 8-hour training requirements set out by WorkSafe and helps to standardize the training for your committee members, especially for those committees that see frequent turnover. You don't have to worry about time like hosting in-house training or getting everyone in the same room all together for another, meeting or whatever. So you can just assign the online training and the requirement is met. It's $99 a seat for that course. Okay, and then harassment and violence is the last changing regulation that I'll mention here. And so WorkSafe is looking at essentially amalgamating the bullying and harassment with violence prevention regulation. So really what you need to know here is that new legislation won't call for anything unless it's being practiced as best practice. So ensuring you conduct your violence risk assessment to determine the level of risk and then implement a prevention program accordingly. There's some special considerations for working alone and those who work with the public, and for further direction though, like we can take that offline, and you can let us know if you need some help. The link on this page goes to our violence prevention page, and it has industry examples, different checklists, prevention tasks, training topics, de-escalation and instant response lists. So feel free to check that out. WorkSafe does have minimal updated information on violence prevention, but I assume they're waiting until this regulatory change develops before sharing it out. Okay, on to inspections. So what's the reason for inspections? Well, WorkSafe inspections are an important part of ensuring the health and safety of workers in BC workplaces. So during a WorkSafe inspection, a prevention officer may either call or they'll visit unannounced to inspect your workplace and assess for safe work practices in accordance with the Workers' Compensation Act and the OHS regulation. So inspections really allow WorkSafe to ensure firsthand that employers are meeting those requirements and that ultimately workers are being protected from the hazards that they're exposed to. So there's a variety of ways that inspections get initiated, one being randomly selected as they do targeted outreach to different sectors in the form of inspection and so some of which we'll touch on a little bit later. And then also another common way is that is in response to a serious injury or a claim, or if someone has filed a complaint about you to WorkSafe, whether that's a staff member who isn't happy with something that happened, or a member of the public sees something being done unsafe or maybe an unsafe condition, and then they can report you as well. So in the past couple of years, especially, the tourism and hospitality industry hasn't really seen many visits from prevention officers as we haven't seen as many in our industry as construction or manufacturing potentially has. However, in recent times, those visits have been increasing by WorkSafe, and they're trying to connect more directly with employers proactively to help educate them at the same time as in ensuring compliance and holding employers accountable for their responsibilities as well. Okay, maybe we'll just think to yourself, I guess, if the chat's not working, maybe it is now. What has been some of the most common topics for inspections? If you have had an inspection or have been lucky enough to go through an inspection already recently, maybe in the last year or two, what are some of the topics of the inspections that you've seen? Curious. If I had to hedge a guess, I would probably say Joint Health and Safety Committee, communicable disease, perhaps, making sure that those plans are all put together. Heat stress is also a good one. Okay, so we're going to look at a little bit of the inspection history for hotels in the last little bit. So WorkSafe has a great interactive resource on their website where you can go up and look up industries or injury statistics for your industry, along with inspection activity details as well. So that's where this information comes from. So in 2023, there were 596 inspections in hotels across the province. So from the last numbers that I ran, there are approximately 2,025 hotels operating in the sector within the province. And so based on last year's statistics, you have roughly 1 in 3, 1 in 3.5 chance of being selected for a visit from a prevention officer. So 2022 was a little less, but if you go back to pre-pandemic, it's around 600 as well. So that's pretty average. Now, as you can see, not all inspections have orders attached to them. So what that tells me is that a lot of hotel employers are doing a really good job meeting regulation. Officers are coming in, they're seeing what they need to see, they're issuing the inspection report and moving along rather than having to write those orders. So that's exactly what we hope to continue, and then hopefully decrease the number of orders within your industry as well. Now, there are different themes that we can extract from the inspection data that's available on WorkSafe's website. So this word cloud allows us to see what regulation is being cited the most in those inspections. And then you can also see, well, okay, the general duties of the employer that will most likely always come up because it's such an overarching piece of regulation. But the next biggest ones are the first aid procedures. So that was listed, cited 32 times. Worker orientation and training, 30 times. Working alone, 22 times. More education and training as well, slightly different regulation quoted, but that's 17 times. We got violence prevention 17 times, MSI 15, and joint health and safety committees 14. So you can kind of see where most of the inspections come from when it comes to hotels specifically. Now, out of nearly 600 inspections in 2023, only 2 resulted in monetary penalties. So I hope, without making you too comfortable, you can rest assured that if you're going to do your due diligence in meeting regulation, that there's a good chance that you won't be fined if something is found. So unless you're being really careless or you're allowing workers to be exposed to really high risk, like asbestos or something like that, chances are you're not going to get a monetary penalty. Right now, though, I'd like to bring your attention to the 2024 column. So we're nearly halfway through the year, and there's only 1 monetary penalty for the year so far. However, if we flip to this other slide here, you can see that the monetary value is a lot higher than previous years. So the fine isn't always going to be small. So it will depend on the severity of the deficiency that's found. So in 2023, there were double the amount of penalties. There was 2, but those 2 together added up to less than half of what the one this year is already. So I looked at the data for these 5 years and some of the penalties that were imposed, and some of them were because of hotel renovations being done improperly. So there was asbestos exposure and other hazardous materials in the workplace. So that's not, like, other than doing the renovation itself, that's not operating a hotel. It just happens to be in a hotel. Another one is that a worker sustained an electrical shock injury, which initiated an inspection where they found a variety of electrical hazards. So the site wasn't really being adequately maintained to a proper building standard. And then the one for this year is a lot of compounding aspects to it. So general responsibilities not being met. We've got WMIS considerations, noise exposure, heat stress exposure, improper maintenance on ventilation systems, and asbestos all in the same area. And then the employer didn't really respond within the time allowed within the orders. So that's why you see that high monetary penalty there. Stop work orders also will be issued when penalties are imposed most of the time because of the high risk violations that are occurring. So keep that in mind too. It's not just a monetary penalty, but you'll actually get a stop work order as well. Okay, so now let's talk about our key focus areas for hotels: musculoskeletal injuries and psychological health and safety. Here, WorkSafe launches inspection initiatives that pertain to some industries in particular. So these are the two that apply to our industry specifically. So let's go through each one of them in a little bit more detail. So MSIs. With these types of injuries being the most prominent in our hotel industry, for example, like housekeeping staff or maintenance or ground staff pulling their backs or something along those lines, it's really physical work day in and day out. And it would make sense that that's the most common injury that has quite the recovery time. So therefore, WorkSafe is doing an inspection initiative to help enhance employer and worker awareness of the topic, and then ultimately reduce the risk for MSI injuries within hotels. So the goal really is prevention and trying to prevent those incidents from happening so that our claims costs don't go up, so that workers aren't injured, and all of those types of things. So that's the goal of the initiative. WorkSafe will also have like an educational and consultative approach to the inspection. So the culture of inspections is shifting away from that strict enforcement to more of a collaborative approach. So some of the documents that they're going to want to see when they come on site and are asking about MSIs is the risk assessment documents, any safe work procedures that help combat the risk, education and training logs, and then sometimes they'll also want to see that workers were consulted. So whether you include your joint health and safety committee on the risk assessment or they review it in a meeting 1 month here and there, that might be the way to do it. So they might also want to chat to some employees to see if that they have the knowledge of how to mitigate that risk effectively as well. So just so you know, they might want to talk to some workers and just ask some basic questions about their tasks. Okay, now knowing this, I'd like you to think about your own hotel operation, because there's some things that we can do to prepare for an inspection on this topic specifically. So first, you'll want to review and update the risk assessment and safe work procedures documents that you have. The risk assessments should be reviewed annually or whenever a new hazard is introduced or changed. So schedule that review annually because it has to be done. So you'll want to ensure that staff are educated about the hazards and trained on how to mitigate the risk as well. So maybe putting in some safety talks at the beginning of the day. There's hotel safety videos that WorkSafe has put out that are quite good actually about how to do things safely. So yeah, you can use those in your workplace. You can put up posters. You can do all the different things that help educate and create awareness. Get your joint health and safety committee involved to ensure the worker perspective is taken into consideration. And then lastly, if you're looking in preparing, please do get in touch and we can assist you one-on-one. That's a free service that we provide for everyone in the industry. And it's one of my favorite parts of my job is connecting with employers directly and helping them on certain topics. So please, yes, contact us. Okay, secondly, is the psychological health and safety aspect. So this is becoming a bigger and bigger topic of focus, not only for inspections, but just in general. And even though there isn't specific psych health and safety regulation that can be enforced, the topic really does integrate into various sections of our overall health and safety program. So there are psychological hazards for those who work front desk of our hotels and dealing with hostile guests. There's psychological hazards for our overnight staff, for working alone or maybe having to deal with intoxicated guests as well. So therefore, it's a goal of WorkSafeBC's inspection initiative to increase that awareness of psych health and safety in the workplace, and then also provide some of those resources and improve the psychological health and safety within the workplaces too. So the inspection approach for this topic is going to be that educative, consultative, and then also enforcement driven as well. So through inspections, WorkSafe is going to be conducting some research to see what's currently happening, what is best practice, and then they're also going to be providing some support and materials for workers and employers to address the topics effectively as it evolves. So your health and safety program elements that officers might want to look at when they come to inspect your psych health and safety is those working alone programs, the harassment and violence programs, the new and young worker training, first aid, and joint health and safety committees. So really the question that you'll have to answer is, how is psych health and safety being weaved into the rest of your program elements where the risk is higher? Okay, so taking some, I'm getting ahead of myself. Here we go. So what you can do to prepare, though, is start off by proactively assessing psychological hazards in a variety of positions and implementing the mitigation strategies accordingly to educate and train your staff on the topic. Okay, so you can consult with your joint health and safety committee to help identify those areas that you need improvement on. We also have 2 psych health and safety coaches that can help you integrate these topics into the rest of your program. So if you need assistance doing that, please get in touch, and we'll get you in touch with those psych health and safety coaches who can provide that support for you. We're also going to be launching, in partnership with CMHA-BC, a series of mini training courses, I think within this month, can use as part of your education and training for your staff. So stay tuned for that. It replaces our CARE program, our CARE level 1, 2, and 3 that used to be available. And so that's all coming quite soon, actually, which is very exciting. So think to yourself now, what are some of the things that I need to do to prepare? Oops, I went too fast. There we go. Knowing this information, what are some of the things that are going to be on my to-do list? So, yeah, just starting to actually write things down, starting to actually check things off of the list. It's one thing at a time, right? You want to be as specific as possible with some of the things on your list, so that when you do, there is something to say about actually checking something off the list. So make it small, make it bite-sized pieces. Don't bite off more than you can chew when it comes to preparing for these things. We're going to go over what we can do before, during, and after the inspections now as well. Okay, here we go. So I remember when I had my first inspection. It was a busy day. It was really high season. I was working away from my desk, doing something at my desk, and then a call came in over the radio, and they were like, "Lonnie, WorkSafe's here for an inspection." And I was like, "Say that again? What's happening? Who's here?" Right? And I was so taken aback because I didn't prepare as much as I probably should have. So what you're going to want to do is adequately prepare. Okay, so do your future self a favor by actually adequately preparing for this. Set some time aside in your schedule to proactively review and revise the documentation for both MSIs and psych health and safety. Decide who's going to be the point person for the inspections. So this is a really, really key point, because not anyone should just be talking to the inspection officer. So those interactions can influence the outcome of the inspections, like greatly influence them. So be sure to select those people specifically, preferably more than one, as it will always happen that, the inspection will happen on your day off if you're the go-to person, right? The persons you choose should be high enough in the company and knowledgeable enough about the health and safety program to adequately answer the questions. Maybe it's 2 of you that work with the inspector. Maybe it's the general manager and the health and safety coordinator or whatever, so that you can answer the questions effectively, and you can show, your care for workplace health and safety and stuff. But I do want to stress that not just anyone can handle the inspection. So choose your representatives well and prepare them for the inspection. You might want to schedule training sessions as required. So it's not just about making sure the paperwork is revised, you also then have to execute what it says in that paperwork. So if, for example, it says educate staff on MSI injuries and how to protect themselves, do that. Make sure you're tracking the training. Get everybody up to speed when it comes to all these topics. Engage with your joint health and safety committee and worker reps. So they will be your greatest asset in completing some of the legwork in order to prepare for an inspection. And so use them. They can help you with, reviewing the risk assessments. They can help you with writing safe work procedures. They can help you with understanding what the workers are experiencing and where some of your focus needs to go. Another thing you can do is to sign up for our so WorkSafeBC also has e-news that I highly suggest signing up for. And then go to HR. We usually amplify the message from WorkSafe, especially if it has to do with our industry, and usually we put an industry spin on it. So hopefully it helps you understand, especially with regulation. Sometimes it can be like reading a different language. So yeah, sign up for our newsletters and you'll get all of the most up-to-date information with that industry spin on it. And then get in touch with us for further support. So we're always here for you. We have lots of customizable resources and information. I really enjoy, like I said before, getting together with employers and helping them, meet regulation or try to figure out a problem that they're having and what we can do to fix it, that kind of stuff. And that's not a one-off. Like that's an open invitation for further support, even if you just need a sounding board for something, even if you're feeling like you're doing really well and you want to amplify your program or level it up, let us know, and we can help you do some of that. Okay, what to do during an inspection. Okay, so stay calm and be respectful. I remember when they said, oh yeah, Lonnie, WorkSafe is here. My blood pressure, my pulse started going so fast. And so just try and stay calm, be respectful. Sometimes it can be hard as they're coming and asking all of these questions, but if we're able to try and keep that collaborative approach, it will be a more pleasant experience for both you and them, and that will show through your inspection report. So employers also have the responsibility to cooperate with inspection officers. So you have to provide the requested documentation if you have it. If you don't have it, then they'll probably say, create it and then show me. But if you have it at that point, you can't just say, no, I don't need to share that with you. You, by regulation, you have to share that with them. And then don't be too shy to communicate the care for your workplace health and safety and your workers. Make sure that that comes through, whether it's you blatantly say it or make sure you somehow communicate that care for workplace health and safety to that officer. You can also let others know that WorkSafe is on site. So if they're going to be doing something that might be a little unsafe, then they can think twice about it before you walk around the corner and there's a maintenance guy who didn't want to get a ladder. So he's, standing on top of a chair, on top of a box or something. So it's not a secret when they're on site. So let others know and maybe have a protocol of like, okay, this is how it gets communicated to everybody that officer is on site currently and, be on your best behavior type of thing. You'll want to make notes as well of the key discussion points, especially if you have to follow up with sending them electronic documents of some kind. So this will also come in handy when you're debriefing after the inspection because you'll have a written record of what was talked about, what you did well, what he asked for, but you didn't really have, that kind of thing. If management is offsite, you'll want to make sure that you notify them that an inspection is occurring. So they'll want to know at the earliest convenience that something's happening, and maybe they can come on site and help out if needed. So something like that. If they're not on site, they'll want to know that somebody's on site, and then if they can kind of come help if needed. And then you'll want to ask a lot of questions. Okay, so communicate clearly, ask questions. Their inspection report is going to be written based on their interactions with you. So as I said before, how you communicate or interact with officers can really influence the outcomes. So be clear, ask questions, communicate effectively, do what you can during the inspection to make it go smoothly, and really put your best foot forward in that situation. Drop everything else, and this is your top priority at that moment. Okay, and lastly, after the inspection. So what is going to go on after the inspection? Well, before too much time passes, you should do a small informal debrief on how the inspection went. So maybe a small group of managers gets together, the GM and, his HR manager and the top couple of people. Now, what did they ask for? These are some of the questions that you can ask during that small informal debrief. So what did they ask for? Were you able to provide it? How did you feel when the inspection was happening? Was there any unsafe conditions that they noted around the property? What went well? What could you do better next time? All of those types of questions can be answered in that small debrief and will set you up for success further when you're preparing for the next one. You'll also receive that inspection report. So quite soon after, I would say, probably the most likely the day of the inspection, you'll receive that, unless they have a lot of notes that they have to incorporate into it. So it's also going to be available online through the employer portal as well. So you'll want to read and address any orders that come in a timely manner. So that should be the highest priority on your priority list. And they usually do give you deadlines. So make sure you note those. Hopefully they'll take into consideration the busy season when they give you those deadlines, but that's not always the case if the for injury to potentially happen. So you'll need to also post the inspection report on the safety notice board. And so that's a requirement that's written right on the inspection report. So just follow the instructions that it says on the inspection report there. You can also get in touch with us if you're struggling to address any of the orders listed. So we can help you get those things done really quickly, and it won't take up so much of your time. So even if you think you can do it by yourself, that's totally great, but you can just speed up the process by asking us, and we can provide the templates and the other resources that could potentially help you. And yeah, get prepared for the next inspection. I kind of say that cheekily, but it's true. Like, that can happen at any time. So turn around and get ready for the next one. Okay, so for resources we have for you within this topic, we have an accommodation classification unit page that gives you a bunch of different resources and a profile. The injury profile is on there for your industry, and all of those types of things. So we have that CU page, and we also have the resources page that is a screenshot here of the resources page. So it's got a risk assessment tool for accommodation. It's got how to implement a formal health and safety program. It's got working alone information. It's got the videos that I mentioned before that are for housekeeping. It's got everything that you'll need on that resources page. And then we also have what we call the Safety Basics Assessment Tool. So if you want to know where you sit when it comes to meeting regulation, you can do it. Probably takes like 10 minutes. You can do that assessment. It's a series of 13 yes or no questions, and this is question number 1 on it. Do you have a current documented health and safety policy? So it just goes through, here's all the questions here at the top. And so it just goes through all the questions and allows you to answer them. And then after, it will send you a detailed report of where, like an action report of where you need to maybe spend a little bit more time on your program and increase or improve it. And then it will give you the resources that we have that specifically address that requirement. So there's that. We also have a psych health and safety audit tool. It's not posted on the website because it kind of goes hand in hand with the one-on-one support from our health and safety coaches. So get in touch if you'd like to see that. And that is a good stepping stone in order to see where you're doing well and where the psych health and safety category within your program. We also have a health and safety training library that's linked on there as well. And we recently added an MSI course to our CCOHS free offerings. So there's a prevention course for MSIs that I think it's listed at like $60 a spot, but for industry, we have secured a bunch of free seats. So if you're looking at that, if you're looking at doing some MSI training, maybe one of your joint health and safety committee members can use their 8 hours of educational leave, annual educational leave, and take that MSI course and then bring that knowledge back and be able to provide some more support in identifying and addressing some of those concerns. So lots of different things like that. With the support that you get from GoToHR, that's my email address. You can always get us at safety@gotohr.ca if you don't remember how to spell my name or anything. We have our psychological consultants. So Aaron and Nicole work for the whole province in supporting employers implementing those psych health and safety considerations within their programs. That QR code will take you to our advisory service booking form, so you can check that out and fill it in if you want us to reach out to you. And then we also have more resources from a variety of different areas there. So the industry statistics is the first link there. That's where I got all of the injury statistics and industry inspection information. So you can check that out, play around with it. We have a list of MSI and psych health and safety resources there from WorkSafe and CCOHS. And then I also put the Employer Advisor's Office on there as well. So if you aren't aware, the Employer Advisor's Office is there for you. It's a free service as well, separate from WorkSafeBC, but still government funded. It's there to help you navigate any claims that you have. It's also there, say you get an order that you don't necessarily agree with or something, they can help you navigate some of the like review and disputing of those types of things as well. So they're a key resource that sometimes isn't utilized as much as it could be. Okay, so a quick little recap. We talked about inspections, like an overview of what the inspections are going to look like. Then we talked about the MSI and the psych health and safety areas of focus, and then what you can do now. So how you can prepare for before, during, and after the inspection. And then we talked about the available resources and support that's out there for you, because you're not alone. You don't have to do it alone. You can be successful with help from us, and then you don't really have to worry about it too much. And then now we're going to go to Q&A here. So I'll pass it back over to Justin, who's going to facilitate our Q&A section of the presentation.
Awesome. Thanks so much, Lonnie. That was very great. I'm going to start with the first question. Will we have access to a copy of this webinar? Will that be available, Lonnie?
Yeah, I do believe so. For sure, I know it's been recorded, so that's good. And then the slide deck, as well as the resources and everything, will come after. So Gareth, I think at BCHA will probably be the one to send that out, right, Gareth?
Yeah, exactly. So I'll answer that one in the coming days. We'll get the recorded webinar on our website, and we'll send out an email to all attendees and include the recording, as well as maybe some of the key resources, Lonnie, that you've shared in this presentation. And if that's okay with you, we can include the full slide deck
Yeah,
there.
for sure.
So,
I'll send it over in a PDF for you, so it's easy.
Awesome.
Next question.
We'll let the ideas brew very quickly. I know I saw some hands were up during the presentation. I'm not sure if it's an error or if anybody wanted to ask those questions now.
Yeah, that's right. I think one was just by accident.
Oh,
I see one hand up from Sarah. Maybe I'll try to allow her to talk just in case. Um, but I see one has come through from Matthew there.
so Matthew's asking, was there something about a go-to HR course in regard to setting up and supporting a JHSC?
Um, Not specific course. There might have been a webinar that was hosted about that. That is something that we have actually been talking about hosting again. So that could be something that we do. But we can talk about that one-on-one as well if you'd like to. WorkSafeBC actually has a handbook for joint health and safety committees that's actually quite useful. And so I would suggest that as well. It has a bunch in the back of that book. It tells you all of the what you need to do, and then in the back of that book, it has a bunch of templates and resources as well. So for meeting minutes and rules of procedures and all that kind of stuff, that's available there too. So yeah, reach out to us if you'd like more support on getting your joint health and safety committee up and running and becoming effective instead of just, ticking it off. Okay, we met this month. Back to work, everybody. It really has the ability to make a difference and really improve and enhance your health and safety culture. And so that's the one way to do it, is to get your joint health and safety committee up and going.
Okay, great. Anything else?
I guess that means it was a very comprehensive
Yeah,
presentation there.
covered anything. Oh, is
Do
another
we,
question has come through actually. Is it necessary to record all trainings for documentation? What level of documentation should be maintained on that?
um, there's there's two ways of doing training, recording training. So whether it's, say you have, you know, I don't know, a group of 10 people starting all at the same day, and they go through the same orientation, then you can do one sheet for everybody, write down what was discussed and what was reviewed, there, the date and all that kind of stuff. So it's one page for everyone and what was covered. Or you can basically, I've seen it before too, where each person has their own checklist of things that need to be covered. And so then they write, okay, we covered this on this day. And then the worker signs off that they've covered everything. And then the employer signs off that they've covered everything. It's almost like a one sheet passport per person. And so then they kind of track their own training. That's probably the way that I would do it if I was in your shoes of recording all that training. And then when it comes to more of the informal training, so for instance, like a safety talk at the beginning of the day or something like that, the logging that can also be done just on one sheet of paper and put into a binder as well. So there's different ways of doing it. We have some templates for those training logs on our website. So if you just go to the search bar and type in training log or training record, they should pop up for you. And then that kind of covers what you need to cover. The OHS orientation has a specific list of things that need to be covered in it. And so what we've done is we've put together an industry specific health and safety orientation checklist that can be downloaded from our website as well. So it's called the New Hire Health and Safety Orientation Checklist. So I can include that too if you wish. But that you want to make sure that you cover all of the points on that checklist, because that's regulated, that they need to cover that. So.
Thank
No
you. Thank you,
problem.
Lonnie.
I have a question for the group. We can turn tables here. I'm just curious how many people, I don't know if we can do this by raising hands or putting yes in the chat, how many people have had an inspection in the last year?
Good question. You got one no.
One no.
Couple hands up.
All right,
Oh
yes.
yeah. Yeah, it's probably a pretty mix.
Okay, there's a few, there's 4 or 5 now. Yeah.
August.
2, 7, yeah.
Late 2022.
Hmm.
Okay. So we got a little bit of a mixed bag, which is nice. But yeah, like I said, 1 in 3.5, I think it is. So in the year. So summer 2023. Do they tend to come, I wonder, when you're in the busiest part of your day? Because I feel like that's what happened to me all the time.
Then we got
Yeah. Okay, so now I have another question. So at the beginning, I asked you on a scale from 1 to 10 on how prepared you feel or how confident you feel. So what's the difference? What were you at the beginning of this presentation, and do you feel more qualified, or qualified is probably not the right word, more ready to take on an inspection potentially? Oh yeah, during check-in, say 8. Oh no, we made more questions for you than answers. Well, get in touch with us and we'll help you if you want more support on a one-on-one basis too. Thank you, Reed. Awesome. And yeah, questions aren't popping up now for you, but then, an hour, 2 hours, you look back at some of the resources and you're like, oh, I should have asked this. Yeah, feel free to get in touch, like I said, and we'll hop on a call. I'll email you back, whatever works for you, to provide some of that extra support for you, especially if you have specific things for your hotel that you don't necessarily want to share in the group. That's totally fine too. And we can address that one-on-one as well.
Well, Lonnie, it looks like you had a positive effect on the group. I'm seeing lots of improvements in people's
Yes.
sentiment towards this issue. So
Yeah. Yeah.
good
I
job.
remember I was in a group in February and I said, oh, yeah, inspections might happen. And nearly everyone around the table, yep, us too. Oh, yeah, we had one, so it definitely is happening more and more. And so being prepared as much as possible so that we can ace those inspections is the best way to go about it. So,
Yeah, I agree. I mean, I actually have a background in risk management, and I think like you weave this into your corporate culture, you're transparent and you help people understand what their role can be in regards to
mm,
these matters, and it makes a big difference.
totally.
Okay.
How long do we need to keep the inspection notices on the health and safety board? Great question. I think if I remember correctly, it's 30 days or until the order has been completed, whichever is longer or whichever is shorter. I can't remember. So there's definitely read the inspection report, and it will tell you exactly how long you need to put it on the notice board. It just needs to be available for workers to review if they want to. And so you don't have to like send out a notice that you got an inspection and you're in trouble or anything like that, but it does need to be posted so that workers have the ability to review it.
Lonnie, do you by chance have sample inspection forms for people to have
I
access?
might be able to find one. I don't currently have any that I can share off the top of my head. But another thing where you could potentially go and see maybe ones that you've had in the past from years ago, if you don't have any currently, is to go on your WorkSafeBC employer profile. Log into your employer profile, and behind there you'll be able to find health and safety information. There will be all these tiles. One will say health and safety information, and then you can click on that, and potentially there will be like a history of the inspections that your hotel has had in the past, so that you can review them at that point as well. That might be a way to find one as an example.
Okay, well, looks like we're banging up on 12 o'clock now. So I think, oh, we've got one other question here, actually.
Yeah,
Um,
so that can just be in staff only areas. It doesn't have to be public, as far as I'm aware. So.
Okay, any last minute questions to pop in?
To access the website. Yeah, the website, it's you just go worksafebc.com, and then you can click up in the login in the top right hand corner. It'll say login, and then you might need a login from your head office or something, like your manager, your general manager or something, but they can provide you access and limited access too. So if you want to see that information, but you don't want to see the claims information, that can all be split out so that you can kind of see some of that health and safety information without seeing all of the claims information. Sorry, Gareth, wrap us up.
Yeah, that's all right. Okay. If there's no final questions, we'll say goodbye for now. Just want to say thank you very much, Lonnie, for sharing your wealth of knowledge here, expertise, some really practical tips for hotels to follow and in their preparation for these inspections and what to do afterwards and whatnot. So
Yeah,
thanks
no
a lot
problem.
for your time.
Yeah, no worries. Have a great day, everyone. Look forward to seeing your emails in my inbox.